Hey, my name is Austin. I'm gonna be your nurse today. Can you tell me your name and date of birth? All right, Mr. Rogers. We got some orders for some blood for you. And I'd make sure it has signed consent, the blood's compatible, cross-matched, and teach anything that it needs to know about it. All right, so we do some hand hygiene, privacy. All right, I got my IV fluids. I'm gonna check for color, clarity, make sure there's no cracks, make sure the expiration date's in. So once all that's checked, let's set that to the side. Then I got all my supplies. Go ahead and put on my gloves before I start opening all that. Gloves on. Right. Once I have my IV tubing out, make sure the lines are all intact, no cracks in them or anything. Make sure, of course, on the package that it's in date. So once all that's taken care of, I'll go ahead and start opening my lines up. All right, let's take a look at them. Okay. Go ahead and get my clamps rolled up. All right. Go ahead and spike my IV to me. Right. Open the clamp up. Fill the chamber to about halfway. All right. So once that's going. All right. So now I would check, make sure he doesn't have any allergies to medication. Everything's good for that. So once all that's taken care of, I'll go ahead and prime my IV tube. Loosen the cap a little bit. Okay. So my IV tube is prime, no bubbles or air bubbles anywhere. Everything is good. All right. So once all that's done, I will go ahead and get my blood. And once I get my blood with me, go ahead and get a preset of vital signs, make sure everything's stable and normal. Once the preset of vital signs check out, I will get the blood and check with the medication, the order form. And after that, make sure everything matches, is compatible, make sure it matches the blood band, the unit, and the form. All right, so once I do all this, I'll get another nurse to come in and verify this with me, and they would come in, check for the same thing, make sure it's all compatible. So once it is, everything is compatible. All right, so once we got all that, we get our blood. Come over here. spike our blood. Switch spots. Hang that right there. We're gonna let our blood go. I want that blood come on down. Alright. So once the blood starts coming in, everything is good. So we'll go ahead and connect Mr. Rogers. And I got the roller clamp shut off, haven't started the transfusion yet. And I checked the IV earlier to make sure it was compatible. Alright. So we got Mr. Rogers connected. Alright, so after he's connected, I would go ahead and tell him to be able to watch for any kind of hemolytic reactions, fever, back pain, shortness of breath, any kind of just feeling off. I would do that. So once he's going for that, I would set the pump to 2 mils per 15 minutes, and I would stay with the patient and monitor them. And after the 15 minutes up, get another set of vital signs if they're within normal range and the patient does not verbalize any kind of adverse reaction or feeling off. I would continue with the amount the doctor had ordered. Once that's going, I would continue to monitor my patient as the blood transfusion as it infuses, and then after that, do the discontinue.